Hi,
It's how are you today?
I'm good. How are you?
I'm fine. Can you see our patient?
I can.
You can. Good. My name is Dr. Kabir. What is the name of the doctor on the other side?
My name is Christopher Carl. Um,
Christabel Karle.
yes.
That's great, Dr. Christabel. It's nice meeting you today.
It's nice meeting you.
All right. Before you is our patient. You can see him. Can you see him? Is
Mhm.
looking sick.
Mhm.
His name is Usman Zakaria.
Okay.
That's his auntie. Can you see the auntie?
I can.
All right. Can you see her?
Yes.
Good. This is the auntie. She has to come and stay with our patient because the mother has 10 children.
Okay.
The other child, one of the child is also sick on admission in the hospital.
Mhm.
So it's today is your day. So you can go ahead.
Okay.
We want to say we are happy having you today for this our examination.
Okay. So, can you tell the patient my name and ask him if I can ask him some questions?
Good. Aja, wai Dr. Christabel Karl ya ce yana gaishe ku, yana so yi magana ya tambaye ku questions da sauransu. Okay. So the auntie is saying no problem, that she is also extending her greetings to Dr. Christabel,
Okay.
and that you can go ahead and ask any question you want to ask.
Okay. Um, can you ask why they came in and what uh problems the boy has been having?
Okay. Wai yana so ya sani wanne damuwa ne, me ya kawo ku asibiti, kuma wanne damuwa ne yake damun yara. Okay. What that they came to the hospital today
Mhm.
because the child has been having fever and headache for the past 5 days.
Okay. Um, can you ask if the fever's been constant, if it goes away and then comes back? Um, yeah, can you ask that, please?
All right.
Thank you.
Wai zazzabin yana zuwa ya dawo ne? Okay. That the fever has been continuous for the first 5 days. The child has been having fever. There is no time that he doesn't have fever.
Okay. Um, can you does the boy have a fever right now? Can you check his temperature?
We just took his temperature and
Okay.
it was 38 degrees centigrade.
Okay. Um, can you ask if he's had any stomach pains, please?
Wai yana ciwon ciki ne? Yes, the auntie says he has stomach pain.
Okay. Um, okay. Can you and he's had a headache? Um, can you ask where the headache is? Like if it's in the front of his head, in the back, or everywhere?
Wai ciwon kan yana goshinsa ne ko gaba ɗaya ne kan yake ciwo? Okay, that the headache is frontal. It is in front of the head. It's frontal.
Okay. Can I please run a blood culture on him?
Okay, we have done a blood culture on him.
Okay. What do the results show?
The result yielded Salmonella typhi.
Okay. Okay, cool. Um, does the boy have any problems with his chest, trouble breathing?
Okay, wai yana tari ne ko yana numfashi sama-sama? Okay, the auntie says he doesn't have chest pain, he doesn't have difficulty breathing, no cough.
Okay. Has the has the boy had the fever for 1 week?
Yes, the fever is 5 days.
Okay. Um, does he have a poor appetite? Um,
Yes, the auntie says that since he started this illness, he has difficulty eating. He can't eat well as usual.
okay. Um, I'd also like to run a hemoglobin test on the boy.
Okay, you want to run hemoglobin?
Mm-hmm. Yes, please.
We did hemoglobin for him. It was 12.6 gram per deciliter.
Okay, that's fine. Um, and he has no trouble breathing, so that's good.
He has no problem breathing.
Okay. Um, does he have shivers? Um, does the boy have any shivers or a runny nose?
He doesn't have running nose.
Uh-huh. Okay. Um, can you do a blood film for me, please?
Okay, we have done a blood film for him, and the blood film did not yield anything. It
Okay.
was negative. It was negative for malaria.
Okay. So it appears to me from doing the tests that the boy has a typhoid. Um,
Okay,
he should go on antibiotics. Um,
okay,
and to and then tell the aunt to prevent this, just make sure he's washing his hands before meals, after he goes to the bathroom, um,
okay,
and to stay as sanitary as possible so that he doesn't get typhoid again.
okay. We are going to tell the auntie about these preventive measures.
Okay.
That he has to wash his hand. Haja, can you hear that? That Usman has to wash his hands anytime he comes out from toilet, and ensure that he takes clean water and avoid taking contaminated water.
Like I that's the only disease that he has. Um,
Okay.
okay.
All right. So do you mind also trying to know more about his background?
Yeah, of course. Sh-
Okay, Usman is 6 years old, a preschool child. He has not started going to school.
okay.
His mother is a 40-year-old who is a full-time housewife. He has no formal education.
Okay.
The father also has no formal education, but is a businessman. He sells charcoal. You know charcoal, the cooking charcoal.
I do know what charcoal is.
All right. So, and the father earns less than $100 per month.
Okay.
Usman stays with his parent in Abuja Kwata. It's a community that is mostly occupied by people with low income.
Okay.
It has a very poor sanitation, poor water supply, and the sewage disposal also is not good. Most of their pipes, the water is if the pipe pass through sewages, mostly contaminated by gutters.
Does the family have trouble finding a clean source of water to drink from?
They have trouble finding clean water to drink. Mostly they rely on well water
Okay.
and sometimes rainwater,
Okay.
and less frequently five-borne water, but mostly the pipes are either roasted pipes passing through sewages. The cleanliness of the water cannot be guaranteed.
Okay. Um, I just recommend that they boil the water, um,
Okay,
so that they have a so that the bacteria has a worse chance of getting into their system.
okay, It's all right. We'll do that. We are going to tell the auntie to ensure that they boil the water so that bacteria doesn't get into his system.
Oh, and then for the fever, I recommend anti fever medicine. Um,
Okay. Antipyretics.
mhm. And what is his pain level on a scale of 1 to 10?
Okay, on a scale of 1 to 10, we'll say 5.
It's a 5. Okay. Um, then I recommend pain medicine to make him more comfortable as the antibiotics
Okay. All right.
begin to work.
We are going to get pain medicine to
Okay.
ensure that he is free of abdominal pain.
Okay. And I recommend making sure he does eat, even if he's not hungry, in order to keep his himself healthy and allow the antibiotics to work and to prevent
Okay.
other diseases.
All right. We are going to recommend all this for the patient.
Okay.
That's very good, Dr. Carl. You have really you did very well.
Thank you.
You know, you took your time on this patient,
Mhm.
take his history from his background to what brought him to the hospital.
Mhm.
You have examined him. You check for follow. You also check for temperature. You wanted to know his temperature.
Mhm.
You have investigated. You did blood culture for him.
Mhm.
You did RDT for him.
Mhm.
All these are things. You also do full blood count. All
Mhm.
these are things that you will help you in making it. You were able to get salmonella from the uh, blood culture, and that suggests typhoid fever, which you adequately treated with antibiotics.
Mhm.
You also went for that to recommend preventive measures. You know, Salmonella typhi is contaminated from, is mostly fecal. The infection is fecal-oral.
Mhm.
It is acquired by ingestions of contaminated water or food.
Yes.
And basically, this patient, based on his background, that is where he gets his own typhoid fever. And we
Okay.
are going to ensure, like you advise, that the parent ensure that patient takes clean water by
Mhm.
ensuring that the water is boiled before taking.
Mhm.
So we want to say thank you very much, Dr. Carl. You really did very well.
Mhm.
I wish I am the patient to
Mhm.
have the opportunity to be examined by this very big doctor.
Thank you.
Thank you very much.
Thank you.
So the mother, one you can see the mother is waving her hand and saying thank you very much. Usman is even though Usman is sick, he is also trying to wave his hand to say thank you for
Thank
having
you.
your time coming all the way from United States of America to examine and treat Usman. Thank you very much and God bless.
God bless you. Thank you.
Yeah, yeah, bye bye.
Bye.
Well done. Bye.